It's been a long-standing guarantee from the Ford government about who covers your health care bill in a private surgical center.
Care when they need it, paid for by their OHIP card, not their credit card.
But as the province scales up the number of private clinics in Ontario, fresh concerns are being raised about whether patients can be upsold before they undergo a procedure.
If you want to wait for the OHIP-funded care, then you're going to be waiting a year, or I could do, your procedure earlier for a fee.
The Ford government recently announced it was spending $125 million to add up to 20,000 knee and hip replacement surgeries in private surgical centers. Those centers will be paid a facility fee, an average of $6,000 per procedure on top of the OHIP costs for the surgery itself. But provincial documents also suggest those private facilities could have another stream of revenue directly from patients themselves. Clinics are being told by Queen's Park if they want a provincial license to open their doors, they would have to list any uninsured, out-of-pocket fees for services clearly on their websites. And while they can upsell a patient, those charges come with caveats. Clinics cannot refuse OHIP services to a patient who chooses not to purchase uninsured upgrades. And patients won't be allowed to receive OHIP services faster than anybody else at the center simply by paying out of pocket. Critics say that puts a tremendous onus on the patient themselves.
It takes a lot for a patient to understand that that's happening to them because implicitly, patients trust their healthcare providers. They don't necessarily know what your doctor is getting paid for from the government and what your doctor is asking to be paid for inappropriately.
Opposition parties are calling for better guardrails to ensure that patients come before profits.